Okay, so today we're going to be doing an extra exam on Spencer. The room is already sterilized for when he comes in, so we've done all of our infection control already. We are ready to get started, and I have all my PPE on, my mask, gloves, glasses, and the lighting is good so we can see all of the structures on him. How you doing today, Spencer?
Really good.
Good. Okay, so today we're going to be doing an extra exam of your head and neck, okay?
Mm-hmm.
Let me know if anything feels tender or you have any discomfort, okay? Okay. So let's start by looking at your eyes, make sure they're not dilated and there's nothing irregular like a growth around your eye or anything. Can you follow my finger just to make sure you got good eye movement? Good. Perfect. And then I'm going to be checking your hairline, okay? So tilt your head back just a little bit. For any lumps, bumps, discoloration, okay? And then I want to check behind your ear. Palpate that. That's called the postauricular. So check behind his ears. Most patients don't know if they have anything abnormal behind their ear. And then I want to check the preauricular. Palpate there in front of the ear. And then I'm going to have Spencer lay his head on my arm and I'll hold his chin for support. I'm going to squeeze his sternocleidomastoid muscle and I'm going to palpate the cervical nodes, which are medial to that. And then I'm going to do it to the other side. So squeeze that sternocleidomastoid muscle, palpate those cervical nodes. I'm going to have him tilt his head down so I can get those occipital nodes in the back of his head and palpate those. And then I'm going to give him a little massage so I can feel that trapezius muscle. And then I'm going above the clavicle and feeling the supraclavicular nodes and palpating those. And then I'm going to come forward. You want to do this from the front side. You want to feel for the submandibular nodes and roll when you're doing that. And then I'm going to check his thyroid and trachea and move it side to side. Just make sure, and swallow for me. Make sure you have good movement, especially when swallowing. And palpate there. Do you have any discomfort with that? Okay, perfect. And then I am going to feel along your temple and feel the temporalis muscle. And then I am going to have you clench so I can feel the masseter muscle. Perfect. Feels really good. Then open really big. We'll check the TMJ. Bite down. Perfect. No popping or clicking. If there was, we'll want to note that. And then open again. No popping or clicking. Do it side to side. Or lower jaw. Perfect. No popping or clicking. And then open big and move it forward and back. Perfect. No popping or clicking. Okay, that's great. I also want to feel along his ramus and his posterior and inferior mandible. And along the zygomatic arch, the maxillary sinus palpating, the parotid gland palpating, and then I think that is everything. So we cleared it all. Did you feel any discomfort? I also want to document the size, texture, color of any of his moles. So he does have 2 moles right here, and he does have 1 mole over here that I want to document in his patient record. And that is everything for the extra oral exam.